help them also. All right, so. Okay, so obtain comprehensive health history and perform physical examination or for what is this on clients who are different spectrum of developmental age. But like we're only going to be seeing patients who are adult, right? So like in other words, we're going to talk a little bit. There is one chapter about pediatrics that is a recorded chapter. Dr. Gelardi and Dr. Tertabitian is doing it. So it's at the end. Okay, so like it's only one chapter, like I think Dr. Gerard is talking 1 hour and the Tertabitian is talking 1 hour. So in other words, there is only 2 hours of pediatric lecture. That's part of this course. It's at the end. I'm asking a few questions about it during the final exam. But like when we're doing assessment on each other in the lab, so you're all adults kind of. So you're not going to be seeing a baby to examine because that's you're going to be learning in pediatrics. Is that clear? All right, so, and then demonstrate proficiency in physical assessment techniques to determine health status and self-care needs of the individual. So in other words, here, you're going to be learning in this course together with the lab. When I'm saying this course, you take into consideration the lab because they're married together. All right, so the lab is the extension of this course. Is that clear, guys? All right, so in other words, at the end of this course, you're going to be able to do head-to-toe assessment, and then your skills have to be developed. All right, so it's not that, okay, yeah, I checked the eye or I checked the mouth, I did, but I mean, I just did it. It doesn't matter, like I did it right or wrong. No, you have to do it right. Is that clear? So skill proficiency is evaluated also. Is that clear, guys? So like when you're doing percussion, so like you have to do the right percussion, in other words. You can't do like this. Or, I mean, you know, it has to be, the skill is evaluated. Am I making sense? So for that reason, the lab is the place that you kind of develop. And then if you see that you are unable to do it, you ask for help. And the more you do, the better you become. I mean, there is no magic formula. Is that clear, guys? Okay, so then when you document health assessment data in a systematic and accurate format and include a family genogram. So at the end of this, what's that? This paper, you have to write a paper like this. All right, so for the lab, not this course, the lab. But you know, so like you have to write two papers. One paper is like without physical exam component of it, and then the other paper, which is the last paper, it's a comprehensive paper. All right, so you all have seen probably H&P, like history and physical, done by doctors. Okay, so you're doing the same. Is that clear? And then like it takes 1 hour for me to correct these papers. I give a lot of attention, but at the end of this course, you learn how to write a history and physical. Is that clear, guys? Okay, so, and then I have put a sample. The sample is from the book, so it's not any student sample, so that there is no bias. So your book has a sample in chapter 26. Did I write chapter 26? Is it chapter 26? What does it say chapter today? 5? A 5? Is it 5? Okay. What is this? Chapter 5. Okay, very good. Okay, yeah, because this, this pages 71 and 73, that's where the physical exam of a case is written. Is that clear? So I took the case out of that book, and then I had a student type it in an APA format like this, and then I posted it. Is that clear? So in other words, and then, but like for next week, what I want you to do, read the sample in the book and then read the same sample, the same case that is written in APA format and it is posted. Is that clear? So in other words, so the case is like very non-biased case because it is given by the publisher. It's not a student work or anything. Does that make sense, guys? So for that reason, there is no debate about it because I didn't write it. It's a publisher's case study, but we took it from the book and it's like I had a student write it in APA format, and then I gave that to the librarian, and the librarian looked as far as the APA formatting. That's fixed too. So you can use that sample as your kind of model. What else you want me to do, right? Okay. So you know the format that I'm asking, and so you cannot be offline from the format. Is that clear, guys? So APA is enforced. You have to know how to write APA. There is no excuse because like from now on, every paper that you're writing, it's APA formatting. And then so the APA formatting, do I know all the rules? No. I don't know all the rules of APA. For that reason, I gave them to the librarian because that's their specialty. But for that reason, what do? You always refer to APA manual. Is that clear? So in the old days, in the manual, it was like hard copy, and then we bought it as students. You don't have to buy it now because it's online. Is that clear? Anything that you are not sure, it's comma, it's a point, it's parentheses. How am I writing? You Google. And then you go to the APA formatting, and then you cite it. In your references, every time like you're doing any work that reflects APA formatting, you have to reference it because like I know that you looked for it. Is that clear, guys? All right, so yeah.
So when this paper comes up, we should follow the sample, like that outline?
The outline,
but it'll be like
yes,
all of ours.
Yes, yes. And then so the physical exam book that you're having, it's not nursing physical examination. It is a physical examination book that other healthcare professionals use it. Does that make sense? Mm-hmm. So in other words, like other disciplines use it. So for that reason, the plan in that form, in that sample that the publisher wrote it doesn't reflect nursing. So what I did, I took it and customized it and made it nursing. Does that make sense? So the sample that is posted and it says sample from the book, you have to follow that because if there is the plan, it is like nursing specific because if you only follow the book, it's general, right? So because other healthcare professionals use it, and then nursing discipline has its own unique way of discussing nursing diagnosis and the plan. Is that clear? All right, so that's that. And then so we're going to be having genogram. The genogram is this. All right, so the genogram is this. All right, so you have to have a genogram under the family history, and so you have to include 3 generations. And then in the sample, and one of the students she wrote like the steps of doing this. I mean, if you're going to be asking how I did it, I mean, when I was a student, we did it with hand. But here there is no hand, like it was like 30 years ago, so there is no more hand. All right, so in other words, like there is like the steps how you do this. Is this clear? All right, so you have to have 3 generations. All right, so who has children? Okay, so if you have children, I mean, you're the first paper, it's going to be you and your partner. Okay, so one of you is going to be the nurse, the other one is going to be the patient, right? So, and then, and you're going to be switching. So, if you have children, so the child is going to be the youngest generation than you and your parents. Is that clear? So whoever doesn't have children, then you become the youngest generation. Then there is your parents, and then there is your grandparents. Is that clear, guys? Mm-hmm. So in other words, the genogram has to include 3 generations, including the youngest generation. Is that clear? But you don't exclude your grandparents. You write about them in the family history, but you don't have to put in the genogram. Is that clear? Yeah.
It's grandparents from your mom and dad?
Both.
Sides? Okay.
Yes. Yeah, of course, they're both your family. Okay. Yeah, okay, guys. All right, so 3 generations, the youngest, and then then up. But like obviously, if you have children, but like you have grandparents too, you have to write about them in the essay, because if there is any diseases we have to know, because like at the end when you write the family history, all right, so when you write the family history, so you're going to be distinguishing. So what is that disease that is running in the family, right? So the mother died of a stroke, or the father died of complications of cancer. Yeah, so like in other words, like, oh, this is why are we knowing? Why are we asking this? Are we just being nosy? No, because if there is a family history of cancer, that person has risk for cancer. Does that make sense? So these are the big fives. So the big fives are, so heart disease. Okay, so what is heart disease? Okay, CAD, the coronary artery disease. We can put hypertension also, like, you know, and then so that you have MI. All right, so you have atrial fib. Okay, so, all right, so all this, so if somebody has in their family, then that person has the risk of having it, right? Take notes. This is not written anywhere, so like take notes. I always tell you like what is written, what is not written. So now then there is a stroke, and then there is cancer, diabetes. Cancer, alcoholism. Okay, guys, so now this is like, I think it's from Healthy People 2020. Every time like they identify diseases that are like the big five. So kind of this didn't come from my head, in other words, you know, it's Healthy People 2020. All right, so now let's say you're writing the grandmother has CAD, the grandfather has a stroke, the maternal father has diabetes, the maternal grandmother has breast cancer, the mother is so the heart disease. So in other words, you're writing this to me, right? So why are you writing it? Because like you have to come to a conclusion. So at the end, what are you going to write? So positive family history of, okay, cancer, stroke, okay, heart disease, all right, so negative family history, alcoholism, and type 2 diabetes. You see, so the last sentence, you have to write it, you know, like when you did the family history, you're asking, so the maternal grandmother had heart disease, maternal grandfather had a stroke, paternal grandmother had a stroke, paternal grandmother had diabetes. Okay, so the mother had cancer. So like, you know, you're asking generation and generation, right? So at the end, so the last sentence is going to be positive family history of cancer, stroke, heart disease, negative family history of alcoholism and type 2 diabetes. This is just an example. Did you get it? Yeah.
Is it always the big five that we're referring
Yes.
to, or?
Oh, no, you're going to write the other. They can have COPD,
Okay.
but like you're going to write, oh, maternal grandmother had like COPD secondary to 40 years of smoking.
Okay.
You're going to be there. But like, you know, but with COPD, we're not putting risk for. Does that make sense? So the big five is a good question. Yeah, don't ignore the other diseases. I mean, it's not that like we don't give attention, but like we're giving attention to this five. Is that clear, guys? A good question.
What's the difference between positive and negative?
Oh, positive, it means that the family has this. This disease is running in the family. If there is cancer in my family, I have the risk of having cancer. Does that make sense? Because you have to put it in the plan.
And negative?
Negative, they don't have this disease. Is that clear? Yeah.
And also, how do we differentiate if maybe the cancer was environmental?
It doesn't matter. Cancer is cancer. Like, we're not going to the specific now.
Okay.
You know. Okay. So, but like, you know, usually, like if if the family lived in an area that like they all contaminated water, like all of them are then going to be affected.
Okay.
I mean, we're not going to be that specific now. Yeah, very good. Good question. Now,
And then, do we have to specify like type 1, type 2 diabetes? Or like
specify it.
Okay.
Specify it. That doesn't hurt. You know.
So we're gonna be touching on all five, like the big five, and any other diseases?
Yeah, the other diseases is in the essay, but like you don't have to say negative family history of COPD.
Okay.
Does that make sense? But like if the person had COPD, you're gonna write it. Or if they have like other, or Crohn's disease, for example. I mean, it's an inflammatory autoimmune, right? So you don't have to write negative family history of Crohn's disease. But like if the mother has Crohn's disease, you're gonna write the father had Crohn's disease. Does that make sense? Is this clear, guys? All right, so so now positive means that that disease is included in that family, the offspring can have risk for. Negative, it means that there is no alcoholism, there is no stroke. Is that clear? But other diseases have to be included in the history. Am I making sense, guys? Yeah.
Psychological diseases as well, like depression or.
It's not here. I know, it's not that like it's not important, but it's not here.
Okay.
Okay, so but like if they have clinical depression, you have to mention it. All the diseases you have to mention,
Okay.
but like you have to focus on the big five. Is that clear, guys? Okay, yeah. All right, so why is this important? Because like when we're writing the plan, so in the plan, so like, not the plan, problem list. When we're writing the problem list, is somebody recording?
I'm recording.
You're recording? Okay, yeah, because we're gonna give this to the other student. Okay, guys, sorry. Yeah, I'm trying to be I'm thinking about everybody, right? Okay. So problem list, so this is problem list, right? So why are we asking all this question to this patient then doing the physical exam? Because we have to identify problem list, like what is the diseases this patient is going through, because according to the diseases, we have to give them help, right? What is our role otherwise, right? So in the problem list, okay, so in the problem list, the last here, like for example, then you're gonna write, I'm gonna explain what you write here. Risk for cancer, colon, father. All right, so if you have here, like the father had colon cancer, so on the problem list on the bottom, I'm gonna explain how you categorize it, and on the bottom the risk for. So what you write, risk for cancer, colon, father. Is that clear? Okay, so that's how it goes. Yeah.
So for this paper, are we gonna be writing it on ourselves, or we're writing family history?
Okay, there is the paper number 1 and there is paper number 2. Paper number 1 you're writing on each other. So that's you are the patient of your peer, and then the peer is your patient. Is that clear? Mm-hmm. So for that reason, it matters that I have to divide you to the right group. Does that make sense? So in Arpinia's group, Silva's group, and Kavin's group, so you have to pair it with the student that is in that same group. Does that make sense? So for instance, I'm frustrated. I want like this issue to be solved. It's not that like, you cannot have one student from my group, one student from Arpinia's group to be partners, because you're two different shifts. Am I making sense? So that's why I was a little bit frustrated, if you see like my reasoning. Is that clear? Because the interviewing process is a process. It's a learning process also. You wanna, in the lab, you're going to be spending time to gather the information. Is that clear? So the first paper, the patient is you. The second paper, you have to select a family member to be your patient. Is that clear, guys? Okay, so think from that perspective. So the first paper, you don't have much intervention, because like your peer is going to be your patient. You don't have much option, right? All right, so the other one, the second paper, the patient has to be your family member, but I'm asking that family member has at least one chronic disease. You know why? Because then you have to write something substantial. Otherwise, you don't want to say denies, then okay, what are we doing? Does that make sense? So in other words, they have to have either hypertension or COPD or something, Crohn's disease, or something chronic that is like the patient is going to live with it. Because like on the problem list, you have to have a problem to discuss. Is that clear? So think from that perspective, and I don't want you to get somebody so very old, multiple problems, then your problem list is going to be 20. Then like, how are you going to, your paper, it gets complicated. Does that make sense? So find someone that is like between 40 to 65 or 70 years old, relatively healthy. I mean, they can have hypertension, they can have like diabetes or hyperlipidemia, right? So, but on the other hand, like they're not like 80 years old, like with multiple heart failure, COPD, this, then your problem list is going to be very complicated. Is that clear? I don't mind correcting it, but for you, it's going to be extensive. Is that clear? Okay, so think that from now, yeah.
So if they have at least one chronic disease, it doesn't have to be one of the big five?
No,
Right,
it
can
doesn't.
be,
No,
but
it doesn't have to be.
Okay.
It doesn't have to be. The big
That's
five,
just
I
what we're
didn't come from my
discussing.
head. I
Okay.
said it like, Healthy People 2020, they're kind of following these diseases. And then, so I know you asked about depression. Probably Healthy People 2030, they're gonna come with the depression to be one of the big five. Does that make
Okay.
sense? They always change. They see like what is the prevalence, and accordingly we have to address it. There was Healthy People 2010, then 2020, now there is 2030. Yeah. Yeah. Well, did they answer? Did I answer that question?
Yes.
Yeah. Okay. All right. Yeah.
So for our peers, they might not have a chronic
Oh,
disease.
that's I said for paper number 2.
Only for paper number 2.
Yeah, paper number 2. Yeah. Yeah. You pay the first paper. It's like an introductory. You learn, right? Okay. Yeah. So we don't want chronic disease with the peers.
And would we also have to gather like any medication that they're
Yes.
giving them?
Yes. Yeah. That's going to be part of the current disease.
Okay.
Okay. Yeah. All right. So. Now, okay, so document health assessment data in a systematic and accurate format and include a family genogram. Analyze health assessment findings to formulate nursing diagnosis. Okay, let me tell you this. All right, so anyway, so what is this? All right, so now when the patient comes to you, they're coming because, why are they coming to you? Are they coming to socialize with you? No. Why are they coming to you? They have a problem. They have a problem. Very good. They have a problem. All right, correct, guys. The only reason they're coming to you, they have a problem and they're very impatient. Why? Because nobody wants to have a problem. Why do they come to you? Give me an answer, I'm gonna go home, right? So because like, give me a treatment, give me like a prescription, give me a piece of paper with all the instructions. I'm gonna go home, I'm gonna follow, I'm gonna get better, right? So that's how they're coming to you, right? Okay, guys. Now if they're coming to you with a problem in here, what is that problem called? Chief complaint. Is that clear? All right, chief complaint. All right, so now, when they come to you, there is a chief complaint. They can have like the headache, they can have the nausea, they can have their vomiting, but like what is really brought them to you? All right, so like if severe headache, okay, so I have burning with urination. Okay, so what is this? They said this. I have burning with urination. All right, so this is why they came to you. Does that make sense? All right, so and then, so times 3 days. All right, so this is how you're going to be writing. All right, so you're not going to, probably this person has blood also in the urine, but that didn't bring him to you. Does that make sense? So don't say here like a story. Very concise. Is that clear, guys? Okay, I have burning with urination. All right, times 3 days. This is how it's going to be written. Times 3 days. Do you see? Okay, so if you don't write this correctly, I'm going to take grades off. This is very simple instruction, and I want all of you to follow, guys. Okay, all right. So whatever the patient said in a very distinct sentence, very short, and then times and what? Okay, all right, so this is your chief complaint. All right, now, the chief complaint, this is like very concise, right? All right, so now, what are you gonna do? You're gonna ask more questions, right? So, why are you asking more questions? The more you understand about the problem, the better you're gonna come to a conclusion. What is a conclusion? Nursing diagnosis. Is this clear? All right, so like, why are we asking questions? Are we asking because just like we want to be nosy and then gather all this information? No, because at the back of our head, we want to know like what is the problem, because I'm going to give you the right plan of care. I'm going to write it on a piece of paper. I'm going to send you out so that when you go following my plan of care, you're going to get better. Am I making sense, guys? All right, so in other words, every question that you're going to be asking, it has to have a reason. Or otherwise, like if you're not focused, the patients talk. Haven't you seen it? Like they talk, and then there is nothing wrong. Let them talk. But like, first of all, time management is important. Second of all, whatever they're telling you, is it relevant to the problem that they're presenting? Am I making sense, guys? Okay. So now, Now, like obviously you want more information about this, right? So what is this called? HPI. History of present illness. All right, history of present illness. All right, so where do I start? History of present illness. It's nice terminology. Like where do I start? Old card, very good. Old card. All right, so you're going to be starting old card. All right, very good. Old card. All right, so old card, you're going to be asking the old card. So what is the old card? Onset, location, duration, characteristics, aggravating, alleviating factors, radiating, and then treatment. All right, so like what did I do to this problem? And now, like, you know, I did something in the house, but it didn't work. Yes.
On the lecture side, it was old cards with the S being the severity of the pain.
It doesn't matter.
We don't need that
Yeah.
for, okay.
Yeah, the old card is only line of reference.
Okay.
It's not engraved on the stone. All right. So in other words, when you're writing your HPI, you don't have to say the onset was, the location was, the duration was. No, you just like write your notes here, and then you kind of compose an essay, all right, that reflects all this criteria. Am I making sense?
I just wanted to clarify then, we don't write like the severity of the pain on that section, then?
Say it again.
Like the patient comes in and says, oh, I have pain urination, it started blah, 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 here, and my pain level is 5.
Yeah, yeah,
That's where the pain level goes on HPI, that's on us.
yes.
Okay.
Yeah, but you know, like you don't have to write it. Okay, the onset is, the location is, the duration is. Am I making sense? So in other words, this is what is this? This is only line of reference, so you won't forget asking questions. Does that make sense? Yeah. So in other words, the wording doesn't have to be included all the time in the HPI. And then in a lot of situations, you know, so like for example, like some of the mnemonics might not have an answer. And so it can be something that there is no radiating, there is no radiation. Does that make sense? So in other words, like, you know, don't anticipate that every letter has an answer. If it doesn't have an answer, it's okay. This is only a line of reference, so you won't forget asking. The old card can be, in some old card, T is treatment, in some old card there is time. So it doesn't matter like which one you use. This is only a line of reference, as I said. Okay, guys, now, once you write this, you only have done 50% of the HPI. Is this clear? So this is easy. You've done 50% of the HPI. Now here, you're going to be including something else. All right, so now, what is like burning with urination? Okay, let me do a little bit. I have blood in my urine. Okay, with urination. Okay, I'm making it blood because I'm gonna put a point. All right. So when this girl is like 20 years old. All right, 20 years old. All right. So now, when you see blood in my urine with urination, 20-year-old. So in the back of your head, like what are you thinking? UTI, right? Okay, 20 years old. All right, so now, once you come here, okay, so this is like only 50% of the HPI is completed. Now there has to be some kind of a conclusion here. So, but I have blood in my urine with urination. All right, so you're thinking like, what could it be, 20-year-old? So most probably it's UTI, right? Okay, so how did you know? Because it's very prevalent. People have it, people have talked to you, probably we have gone through it, right? So in other words, it was easy to come to a conclusion. But not every problem that your patient is presenting is prevalent and you didn't experience it. How do you know? What do you do? So you put this in the index of your med-surg book. Does that make sense? Blood in the urine. And then so like what does it say? It lists like what are the diseases that present with this sign. Blood in the urine is sign. Why? Because we see it. There is blood in the urine. Is this clear? All right. So, okay. So this was easy because, as I said, this is a very prevalent chief complaint that people complain, right? Okay. So now, then you put it, and then what does it say in the index? Blood in the urine can be UTI. Blood in the urine can be bladder cancer, right? Okay, so now like you're gonna see like, okay, so then you're gonna be asking, okay, this is 20-year-old. How much possibility a 20-year-old blood in the urine will have bladder cancer? 0, right? I mean, okay, bladder cancer 20-year-old, it's like very impossible. But if I had 70-year-old men worked as painter times 40 years, okay, blood in the urine, so what do you think? Could it be bladder cancer? Work as a painter, there is a high correlation, paint and bladder cancer, and a man, and 70-year-old. Okay, so then like here you're gonna be saying, okay, so you're thinking, okay, what were you working? Okay, so like I was working as a painter for 40 years, you know, like, okay, so do you see now? So in other words, this chief complaint, you have to come to a conclusion here. What could it be? Am I making sense? So you can't leave this here. Okay, Dr. Nakashian, I got it. I asked onset, location, duration, characteristic, aggravating, elevating factor, radiating factor, treatment, bah, I'm done. No, you're not done. Okay, don't give me all the way here. Tell me, what do you think? Am I making sense, guys? All right, so how do you know? You put the chief complaint in the index of a MedSearch book, and then you see what are the diseases that present with this sign or symptom. Am I making sense? And then you see how relevant it is to this patient who is presenting with this symptom. Am I making sense, guys?
Yes.
All right. So then like you're going to be asking more questions. Okay, this is a 20-year-old girl. So what are you going to be asking? So you're going to be asking about the hygiene behavior. So how do you wipe yourself? Well, what kind of a work do you do? Like if they're nurses, 12 hours, they're not going to the restroom because they don't have time. So there is more potential for UTI. They're not drinking water. If they're wearing like tight jeans, okay, or like, okay, so like nylon underwear. So all this have correlation that causes UTI. Am I making sense, guys? Okay, so then you have to ask here. And at the end, you know in your head that, okay, 90% it is the UTI of 20-year-old girl is presenting with UTI. Am I making sense? So on the problem list, so now you're coming to the problem list. So the problem list has to be open, a blank paper next to you. Always on the problem list, the first problem is who? The chief complaint. Because the problem list that you gather, so the first problem is going to be your chief complaint. So what are you going to write here? Okay, so blood in urine. Okay, rule out. Possible, what? UTI. Am I making sense? So always, the first problem on the problem list is who? The chief complaint. Because they came to you to get a treatment for this. Is that clear? Yeah.
Are you saying that you're ruling out the UTI, or we are in an assessment to rule out the UTI?
Oh, you're doing possible UTI, right? We're ruling out. We're doing the assessment to rule out the UTI.
Okay.
What is assessment?
So part of our assessment
Yes.
to rule it out.
Yes.
We're not saying because he's 70 he doesn't have a UTI.
No.
Very likely also.
No, right, you're right. So what is an assessment? Assessment is subjective and objective together. Is that clear? What is the subjective? That you're gathering all the information. What is the objective? You did a physical exam on the patient. And accordingly, with this two, you came to the conclusion, which is your assessment or impression. Okay, and then you identified the problem. Is that clear? Okay, I think you're ready for a break. Even though I've done